Yeah, we can start. Yeah. Good morning, all of you. As we are aware that NCPR is organizing Swachh Bharat from 1st of July to 15th of July. In this occasion, we are organizing various activities at NCPR Goa. So we requested Dr. Kalpana from NIO. She will be delivering lecture on post-COVID and its cleanliness. So Dr. Kalpana is passed out from MBBS from Goa Medical College 1993, and she has completed her management courses from Goa Institute of Management 2011, and she is the uh, Chief Medical Officer at CAO, CSR NIO since 2001. So I request Kalpana to please take over.
Thank you. Thank you for the brief intro. Uh, a very good morning to all of you. Uh, I hail from CSIR NIO, and today I'm here in front of all of you to speak on post-COVID. Am I audible? Am I audible?
Yeah, you are audible. You are audible.
Okay. So today's topic is the post-COVID-19 and its awareness and cleanliness as a part of Swachh Bharat mission. Uh, So let's talk first about COVID-19 and what is the connect of this COVID-19 with Swachhata or cleanliness, and what is all the awareness we are talking about. So let us take one thing at a time. So
யூடியூப் பிளாக்
speaking
பண்ணுங்க.
about, can you hear me?
யூடியூப்.
Okay.
Am I audible? Am I audible?
Yeah, Kalpana, you are audible. Please go ahead.
Yeah. So the COVID-19, we all know that this was something which started in Wuhan in China somewhere in December 2019. And over a period, it just went spreading all over the world. And somewhere in March 2020, WHO declared COVID-19 as a pandemic. Now, when this was happening, this was a completely new thing to all of us around the world. There were so many messages, there was so much of information, which was right, which was wrong, so very difficult at times. A lot of learnings were happening, and every time we as doctors also, we were getting to know this virus more and more as the days passed by. Now, there was a lot of confusion. I would say there was a lot of state of confusion, unawareness not only about the virus, about the disease, but about the facilities. But somewhere, like there was the WhatsApp media was very active, but I really appreciate the efforts which were taken by the government to make things very clear to people from time to time, especially the guidelines which were coming from time to time really helped many of us, at least in the medical fraternity. It was of a great help. Now, after speaking about COVID-19, we all know that the numbers were increasing so much so that even in Goa, the scenario in Goa was not far from the scenario which was there all around the world. Now, coming to the topic, COVID-19, there are a few things which I would like to touch upon. We need to know what is the difference between a case and contact. These are the terminologies which were very much used. So, who is a contact and who is a case? Someone who is positive with COVID-19 is considered as a case of COVID-19, and contact is someone who has come in contact with a person who is positive, who is COVID-19 positive. Now, again, in context, we need to understand. Now, here I'm talking a bit of awareness on COVID-19, and then we'll go to the cleanliness part of it. How cleanliness is connected with this. Now, speaking about the context, we all need to know, because when we are in an institute, we need to know that what are the kinds of contact: high risk, intermediate risk, and low risk. Now, what is a high risk contact? High risk contact is someone who is in contact with a COVID positive case, less than 6 feet distance, more than 15 minutes of time without mask. So these are the scenarios. Usually you happen to go with your friend to a canteen, and that's the time your mask is off, your protective gears are off. And in case if one of them happens to be positive, then the other one turns out to be a high risk contact. Intermediate risk is a case, it's a contact wherein you share the same common workspace. Now, this do happen in many of the offices that you would have a big hall and then you have many people sitting around and you share the common space there. We, we put them under intermediate risk. And low risk is something like, you're just going around and just say hi to someone less than a minute on the way. And the person is like, is a COVID positive. So this is considered to be a low risk. Now, let me talk a little bit on what you're going to do with high risk. So, high risk will be advised quarantine because, as we all know, that the cases were just multiplying. And why they were multiplying? Because one case coming in contact with a COVID positive, again, the other person is to turn positive, and then his contacts were increasing, and so the numbers were going on exponential growth in the number of cases. So, what are we going to do with the high risk contact? High risk contact is advised quarantine and they are asked to test after 5 days, preferably sixth or seventh day is always ideal. The intermediate risk is again asked to be quarantined. What is the period of quarantine? The quarantine would be for around 14 days. And the low risk, nothing to be done. They need to just observe for any signs and symptoms. Intermediate risk also is supposed to be observing for any signs and symptoms, but high risk is advised to go in for testing because everybody cannot go on doing testing. The resources also was a problem, especially during the peak period. Now coming to the case, what do we say? I mean, whom would you call as COVID positive? COVID positive, we will say when the person has done a test and it has turned out to be positive. Now, what kind of tests were available? We all know that there are two tests which have been commonly done to detect COVID. One was RT-PCR and the other one was an antigen testing. Now, antigen testing, like how reliable is one? These are the questions we were getting. So how reliable is like which is sensitive, which was more reliable always. But someone who has got an antigen test positive is considered to be positive. But if antigen test is negative, that doesn't mean that the person may be not COVID positive. You need to do an RT-PCR if the person has symptoms. Now, when we were talking about the cases, again, there were categories in the persons who were positive. Some were asymptomatic, some had mild symptoms, some had moderate, and some severe. A little bit on how would you differentiate among these categories. Asymptomatic is someone who did not have any symptoms. He just happens to go to do a test because, oh, I came in contact with so and so. And then I go and do a test. I don't have any symptoms and I turn out to be positive. So I will be put under the category of asymptomatic COVID-19 case. Mild is someone who would have mild fever, a bit of body ache, headache. Now, let us talk about the symptoms. So, which are the common symptoms normally we see with COVID? Fever, cough, sore throat, the kind of patients we got, they were having something or the other. It's not like necessary you have to have all the symptoms to demarcate that case as COVID-19. No, you can have just fever. Some one of them did not have fever. Some had just cough, some had sore throat, some had throat irritation, some came with body ache, headache, malaise. Malaise is a tired feeling, weakness, diarrhea. Some of them just had a gastrointestinal upset. Some would have lack of appetite, nausea, vomiting sensation, loss of smell and taste, shortness of breath. Now, here, these kind of cases was something which we had to be very quick in acting upon. So, shortness of breath was one of the features of this particular thing, which is like supposed to be like putting the patient into a severe category. Now, talking about the mild one, So here, they will have some mild symptoms, and these are the patients who could put them under home isolation. You must have heard this terminology very commonly, home isolation. Moderate would be somebody who would have, say, fever, cough, cold, but in addition, something to do with the respiratory system. Because everywhere there was the entry and the exit point. As we know, this virus enters and exits through the respiratory system more commonly. So the respiratory rate in these patients who were moderate would have more than 24. Like normally, someone would ask me, what is the normal respiratory rate? And somewhere around 12 to 16 is okay. But here you would have people with a respiratory rate who would be breathing a little faster, more than 24. And another instrument which was very commonly used and is still commonly very much used is pulse oximeter. Pulse oximeter would tell you about your oxygen saturation level. Now, anywhere this saturation going above 94 or somewhere around 94, so till the time it is above 94, person is having breathlessness, you would put the patient under moderate category. But when this saturation was falling below 90, then these were categorized as severe. From our point of view, from our clinical point of view, is to categorize them as the severe case. And their respiratory rate also would be more. The breathing rate, respiratory rate would be more than 30, no more till 24. Now, this was something about the respiratory system which I spoke. Apart from the breathing, temperature was another thing which was being checked. So whenever we had any case in home isolation, now another thing I would like to speak before I go ahead and talking about the case, we need to also difference between what is isolation and what is quarantine. That's one topic which I just want to make clear. Isolation is someone who is already COVID positive and is being put under home isolation. But he is kept away only with the, like how we said, he's a contact. The contact who is being kept away from the other people is was like the terminology used for them was quarantined. Now, apart from respiratory rate, the pulse oximetry, pulse pulse was one more entity. Apart from saturation, respiratory rate, pulse, people has to have tachycardia. We all know that the pulse oximeter records two readings. One is the respiratory and one is the pulse. Temperature was another entity which had to be recorded. Now, because we're talking about the case, and I should not miss on to this, I just want to tell all of you that asymptomatic person need not be once categorized asymptomatic will remain asymptomatic. He can go a little bit further into mild, moderate, severe categories. So hence these patients have to be monitored with their temperature, pulse, oxygen saturation, any other symptoms of breathlessness coming upon. There's something now that we're talking about the presentation, I would just want to tell you all there was something called as a 6-minute walk test. I think most of you all must be knowing about it. And wherein person is being asked, a person who's asymptomatic was asked to walk for around 6 minutes within the house and then check, whether you are becoming breathless or. So this test was indicating of these patients, asymptomatic ones who could go further into mild, moderate, severe category. Now, there's something called warning signs, which we were like, always very observant whenever we were monitoring these patients under home isolation, especially high grade fever, suddenly a high grade fever coming, or suddenly the patient becoming very lethargic, feeling very tired and drowsiness, severe cough, breathlessness on exertion. These were some of the warning signs which had to push this asymptomatic person immediately to the hospital. Now, I was just trying to see that I cover up all the points when I'm talking. So we spoke about case, we spoke about contact, types of contact we just said, symptoms, types of tests also we have seen. Now I need to tell you all about COVID appropriate behavior. This was one of the terminologies very common. And what is this COVID appropriate behavior? We all know that our way of living has changed over the past 2 years. It's no more the same. Now, what is the difference which has come in? One is social distancing. which is very, very important from the point of spread of this particular infection. When this COVID thing came, there was a lot of things like, whether this is a droplet infection, whether it's an airborne infection, what is the size of this particle, whether it's less than 5 microns, is it more than 5 microns, and then said, yes, it's a heavy particle, so it will settle on the surfaces. And then that is the reason this distance of 6 feet was being identified. But again, one thing which is very commonly, which I have observed personally, is this infection spreads very fast in a closed space. Open air is a very good, and it's very good to prevent the spread. So apart when I'm talking on social distancing, I would like to touch upon this. So this closed spaces was a problem, especially the places wherein there would be an AC and people sitting in a closed area. This infection would spread very fast. Lifts was another place. So many people had stopped taking lift, and that was a good move. People started taking the staircase more. So social distancing, we also saw that why we have to keep that 6 feet distance. Then moving on to the next one was mask. When we were talking about the COVID appropriate behavior, mask. Now there was a lot of thing, about the mask also, that what kind of mask should be used, who should use N95, whether N95 is the best, so whether I should also start using N95, or surgical mask, triple layered surgical mask, or a cotton mask. And I would say that over a period, government themselves, they came up with the guidelines that the common people, you can use a cloth mask, good enough. But like the people who are working in the healthcare facilities, or the people who are there wherein there are a lot of interactions with the people, other people at the counters, or paramedical staff, they were supposed to put a triple layer mask. And whenever there was any procedure, even for we doctors, when there was any procedure where there was a chance of aerosol generation, like, I'm seeing and examining a throat, and there's a possibility the patient may just cough out, there N95 was a compulsion. Along with that, we had headgears and many more things, PPE kits, depending upon the situation. Now, coming to the mask, I won't get into the details of those. About mask, I would like to say that it is good that you use cloth mask is good enough. Now, if you ask me why, because what I observed in the initial days is people used to wear N95 thinking that it's a good protection that they are taking. Am I audible? Hello? 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 Am I audible? Hello, Swami?
Yeah, you are audible. You are audible.
Okay. Because suddenly the connection was poor, so I just thought. So cloth mask, why it is good and why not the surgical mask? Because what we observed is people were wearing very dirty masks for a day or two, not even changing the mask, and then that is more harmful. That was more detrimental, because the chance of getting infection increases over there. In fact, it is better that we use the cloth mask, which you can come back and then change, because surgical mask or say N95, you have to change it every 6 to 8 hours, and which is not possible with a common person. So best is to use a cloth mask, which you can immediately come and clean, and have a clean mask, which is again very much connected to today's day, that is the Swachh Bharat Abhiyan. So something to do with the cleanliness of the mask, which is very important. Another thing is people were advised that not to touch the mask on and off, because the outer part of the mask would have the virus in case if you have come across anybody. And touching this mask and touching in other places were not very hygienic. Third was respiratory etiquettes. People were advised nobody should spit out, nobody should cough on the mouth or onto the face of another person. Basically the secretions which were like, even they were saying, that if you are talking with each other, then there's a chance that the virus would be spreading. So social distancing, and we spoke about the respiratory etiquettes, and then the mask, and now coming to the hand hygiene, which was most very important again. washing hands with soap frequently. And again, there was a technique how you wash the hands. Even like for us as doctors, we were asked at least we should spend around 40 seconds washing our hands, and we should ensure that all the parts, all the points are being covered when we are washing, say the palm, the back, the interphalangeal area, thumb, the wrist, to that area, and you should be rubbing or scrubbing the area. And then came the sanitizers, which are very, very commonly used. So this is about the COVID appropriate behavior, which I wanted to stress upon. I also told you all the difference between quarantine and home isolation. Now, we said quarantine was our 14 days. What about home isolation? Now, home isolation, the COVID positive patients were in home isolation. They were asked to be for 10 days home isolation from the date of symptoms, or till they are afebrile for at least 3 days. So that was the period of home isolation. And people who could not afford, or it was not possible for them to do home isolation, had to move into a COVID care center. There were many COVID care centers, all of us know, all around in Goa also quite number of COVID care centers were formed, and only the patients with moderate, severe categories were going to the hospital. Now, who are the people? How are we going to decide who will be in home isolation and who will go for COVID care centers? Now, what are the requirements? Rather, I would put it up like this. In your since we spoke of virus which spreads, they're demanding the respiratory system. Persons who opted for home isolation were asked whether they have a single room separate from the rest of the family members in their house. They need to have a separate washroom, and there should be a caretaker 24/7. Now, what is the role of this caretaker? The caretaker would take care of all the requirements, so this person does not have to come out of the room. Plus, he will not be sharing the common washroom, because again, a washroom is a closed space, and the room which has been given or allocated to the person who is called positive usually should be an open, well aerated room, well ventilated room. Now, what are the things which you need to take care? Now, suppose you have a person in your house with home isolation. So here again, a part of the Swachh Bharat Abhiyan, I think we should stress upon what are the do's and don'ts rather for a person who is in home isolation. So you have, or say I have a person in my house who is under home isolation. First and foremost, I should have a separate room, a separate washroom. How am I going to deal with, like, suppose I have to go and give certain things to this person. So I should be wearing a double layer, triple mask, triple layer surgical mask. The person over there who is COVID positive also has to wear the mask. My interaction has to be very less. It's just to go and give the food, or sometimes we need to help the person with something. But ideally, whatever we do, we need to maintain our social distancing, limit our time of interaction. The mask which has been used has to be discarded every 6 hours. You cannot go on using the same mask. Sanitizer has to be frequently used. Preferably, if you are going in to give anything to the patient, you should be washing your hands thoroughly. Apart from this, how you're going to do with the linen, what you're going to do with the vessels. So the vessels, again, they have to be washed. You need to have a separate set for the person. About the linen, it was said that the bed sheets and all, possibly if you could put this, soak them into 0.5% sodium hypochlorite. Everybody of us are aware of the sodium hypochlorite thing now, which has been very common after COVID. You can soak it for 30 minutes and then put it again into warm water, and then after that you can start. You can put it into the machine or something for washing. This was the way you could handle with the linen. Now, what about the flooring? It was said that the dry broom cleaning shouldn't be done, because again, there's a chance that you can just the air can just, the particles can just be again blown up. So that always it was advised that you should do a wet mopping. That was more ideal in case of COVID house. Second thing is about the floor cleaning. If you could use a sodium hypochlorite solution, now again sodium hypochlorite 1% solution, how would it be made? I mean, that was one more thing which was spoken about a lot, because in the market, I think it was coming as in 5% concentrated or 10% concentrated solution. So if you had to make it, like suppose you have a 5% sodium hypochlorite concentrated solution, so the one which you need to dilute or make a 1 liter of it, you could use zero point 0.5, the 0.5, 100 ml of this 0.5% in 900 ml of water. That was the mixture that we were advising to make a 0.5% from a 5% concentrated solution of sodium hypochlorite. And that could be used for linen, then you can use it for mopping in the house. Um, this is about, okay. Now, whenever you're cleaning the floor, you could first clean it uh, with the water and the detergent, then with the plain water, and then with the disinfectant solution, just to maintain the cleanliness. This is something about the environmental sanitation, which I'm talking about in cases where COVID positive patient was there. Now, apart from this, the common areas, like, there was a lot of talk about the handles, the lift knobs, the buttons, which would be commonly used in common areas. So what are the precautions you would take in this kind of situations? So 70% isopropyl alcohol was quite rampantly used for metallic areas. And again, for non-metallic areas, you could use your 0.5% sodium hypochlorite solution. Um, then Yeah, so this was then any patient who was like in home isolation and suddenly found to be deteriorating, which I spoke of the warning signals you happen to, then immediately the caretaker has to contact the hospital, and the hospital is to send a vehicle which would take this business. So again, there were the protocols which had to be followed. Every hospitals had a fixed amount of beds, fixed amount of entry exit points, and there was a lot of awareness which was happening. Now, one point which I would want to talk about is in case of COVID positive case, something called as an proning. Proning was very commonly used a word, and many a times I used to tell my patients, whenever the saturation is dropping, they had to monitor their saturation. Now, how often the saturation? At least 4 times I was asking my patients to monitor their temperature, their pulse, oxygen saturation, and report to me. And if you find that the saturation is dropping, say even after the 6-minute test, if there is any chance of the saturation dropping, they were asked to put themselves into prone position. This is very common, wherein they had to lie down on their chest by putting pillows under the feet, under the thighs, and under the neck. And this is to help to improve the saturation. Uh, yeah, so with this, I think I'm touching on most of the points. And now I come to the vaccination, just not to miss on that, because the talk on COVID is incomplete without talking about the vaccines. I would urge all of you to please, whoever has not taken, go ahead and get your vaccination done, because what we observed in our medical field is people who had taken vaccines, the recovery was good. It did help them. People without vaccines, there were a lot of issues. In case if the person lands up with a severe category, it's very, very difficult. Talking about the vaccines, we all know that there are two types of vaccines which are being available at the moment in India, in our country, Covaxin and Covishield. In Goa, Covishield is there. Covaxin also has come in certain private hospitals being available. We all also know that we need to take 2 doses of the vaccines. The Covishield has got a different schedule. After you take the first dose, and then your second dose would be something around 84 second dose, whereas COVID, the period is less, around 28 days. Uh, yeah, so then there will be certain questions in the mind that, okay, I have got, say I have got COVID and I have to take my vaccine. So when do I take my vaccine? So if you have not taken your vaccine and you have already got COVID, then do take it after 3 months duration. If you have taken your first dose and then you get COVID, then you can take your second dose after 2 months of your COVID infection. And yes, now government is saying that pregnancy lactation, vaccination can be done. Yeah. So with this, I think I've covered most of the points. Swamiji, I'm done.
Yeah. Thank you, Dr. Kalpana, and that it's very good. I couldn't see any questions in the chat box. So, I hope people could understand much better. Still, we can
Yeah.
request that any question is there. Dr. Kalpana is ready to answer it. Okay, looks like there is not much questions here. So I would like to thank you for your valuable time and giving a wonderful webinar lecture on the occasion of Swachh Bharat. So I'm thankful to you on behalf of our director and NCPR Goa. Thank you. Thanks a lot. Bye.
Thank you.
Yeah.